A lot of things interrupt our lives. The obvious thing right now has been the COVID pandemic. Huge interruption to everyone's life. I think a lot of people feel like their lives are just on hold until this is over. But there's always something. There are many things that interrupt our lives all the time. It's not just that. It's our cell phone. It's our work. It's our vacation. It's so many different things. The point is, we need to step back sometimes and think about some things that are important in our own lives. And in particular, I want to talk about prevention along that line, because it's easy to put that off. It's easy to say, oh, I'll make that appointment next week, or I'm too busy this week. You know, the good thing about prevention is some of it is just absolutely free. A lot of it depends on just our own behavior. We just need to think about it a bit. So certainly the COVID thing has brought our attention to things like hand washing and different things like that, not to spread disease. But other things along that line are taking care of our health by eating healthy foods, by getting enough exercise, by moving around more. We found that sitting isn't good for our health. There's a lot of those basic things that we can do without going to the doctor. The other thing I will say that this has interrupted is a lot of the preventive care visits. And those are vitally important to try to keep us all healthy. So some of the key things in prevention that make a huge difference worldwide are things like vaccines in children, things like clinics who are treating malaria, tuberculosis, and AIDS, things like clinics that are treating opioid addiction. All these things have been impacted by the pandemic. It's estimated that we may have up to 1 million additional deaths in the world because of the interruptions in these things. And while it may not be that high in the United States, there's still a big impact to this. Because let's face it, other health conditions aren't on pause just because we're in the middle of a pandemic. We've been through a lot of interruptions from other things before too. There are always things like hurricanes and fires and a lot of different things that can interrupt our lives. But we don't want to put off our preventive care because that has big consequences down the line as well. So even if we think about how many cases of COVID that we have, we also need to think about the fact that the number one killers in the United States are heart disease, cancer, stroke, unintentional injury, lung diseases. Those are all prominent things. And if you look at those categories, it's estimated that there are hundreds of thousands of preventable deaths that occur from those causes every year. In cardiac diseases, we could prevent possibly up to 90,000 deaths a year with some good preventive medicine. These studies are based on people less than 80 years old too. So we're talking about adding not only years to people's lives, but we're also talking about adding life to people's years by helping them live better, more productive lives. So prevention at its rudimentary form involves not doing things that can bring us harm or avoiding things that can harm, hurt, or kill us, and also promoting things that bring us better health. Those are the two parameters of preventive care. Again, some of those you can do yourself. Some of them involve going to a provider and getting a referral. The good news about preventive care that involves the more advanced things is that most insurance companies cover preventive care, and most of them cover it without any out-of-pocket expense to the people that have their product. So that's the good news. A lot of people never get this done, and yet they're actually paying for it in their insurance premiums every month. So you want to get that benefit. You're already paying for it, and it's to your advantage. Insurance companies, in fact, want you to get that because keeping you well is good for you and it's good for them. It's a win-win. Some of the things that you need a referral for, most of you know this already, but it depends on your age, it depends on your sex, it depends on a lot of different things. And it's very personal and individual. So the screenings that I might need for my preventive care will be different than the screenings that you will need for yours and that your children will need or your spouse will need. Having a primary care provider can help you figure out through that what you need. There are some things that because of family history you might need that other people don't. So it's important that you share all those things with your provider and get those referrals and get them done. Many of them don't take much time. Again, some of them are free or very inexpensive, but they are vitally important to your health and well-being. In thinking about prevention, it seems to me that the greatest enemy may be procrastination. So I'm going to appeal to you, make time for yourself, make time for your loved ones, your children, your spouses, for preventive care. It makes a huge difference. And you can start where you are. You can start right now, drinking plenty of water, eating plenty of fruits and vegetables, getting adequate exercise. And I realize it's hot outside right now as I'm doing this, but there are things you can do inside, just getting up and moving around. And then on the don't side, if you smoke, please try to quit. That's the largest preventable healthcare factor in the United States right now. High blood pressure is the next one. That would require probably a visit to your provider to get that checked, but treating that can make a huge difference. The third one, which seems to be rising, is obesity. So that goes back to the exercise and the healthy diet. Those are some things you can work on right now, even in lockdown, even in COVID, even in the heat. There's a lot of things that we can do for ourselves. But don't forget your preventive checkups. Get to know a provider. They need to know your history. They need to know the details of that so they can guide you down the right path to improve your years. John Lennon said, "Life is what happens to us while we're planning other things." That's where it gets away from us. We tend to plan other things and life goes by. These other things aren't on pause because something interrupts us. Make time for prevention. Take care of yourself. Here's to your health.